Thank you, Chair. Minister, I just have a question about the diagnostic breast imaging and breast screen units and the fact that they've been increased to cater for increased demand. And I'm just wondering if you can tell me about the budget for the operations of that facility. Obviously, it's been a capital project, but in terms of the operation of the facility, can Tasmanians and the staff be assured that there'll be sufficient resources in the budget to be able to operate it at the level that the increased infrastructure will enable?
Yeah, thank you. And yes, as you might be aware, went recently just to have a look at progress on the capital works that are being undertaken there in relation to the new diagnostic breast imaging services at the Royal Hobart Hospital. It will have a phased implementation of the service to build the system capacity. Staffing and infrastructure has commenced, and currently the service is limited to referrals received from the Royal. The 2025-26 budget includes $7.5 million over 3 years for additional diagnostic breast imaging clinics to provide statewide public diagnostic mammography services to improve accessibility for Tasmanians. This is in addition to the $18.2 million committed in the 24-25 budget to build the new public diagnostic breast care centre in Hobart. That includes $15 million for infrastructure development and $3.2 million for facility operational costs. Do you wish to make some further comments, Secretary?
Thanks, Minister. In addition, this is an area of health demand. It's another area of imaging. So there is actually money in the health demand budget for operational costs as well. So from this financial year, the operational budget of diagnostic breast screening amounts to around $5.6 million, if I do the maths quickly in my head, from 3 buckets: demand, the 2.5 boost that's in the 25-26 budget as a line item, and the ongoing 1.18, I think it was, from the previous 24-25 budget, which is an ongoing amount. Okay,
and how does that compare to the budget allocated in previous years?
Through you, Minister, there wasn't a budget in previous years because we didn't have a diagnostic breast imaging service, so we established that I think 2 years ago, initially as a pilot funded by the federal government, and the state government has then now provided the money for it to continue to operate ongoing.
And it will expand its operations, I think, importantly too. So at the moment it takes referrals from the hospital, but it will be able to take referrals from general practice as well.
Okay, so we're talking specifically here about the diagnostic breast imaging service. What about the breast screen service that will be co-located?
Yeah. So there will be, as you point out, co-located services with that facility for screening, as well as the diagnostic services. Did you want to ask specifically about that screening centre, or
yes, so
screening across Tasmania?
Well, both, but first of all, will there be adequate resources provided to, because I believe the breast screen service will have increased capacity in the new centre as well, is that right? And if so, will the operating budget be increased to be able to service that?
Yeah, I'll ask the Secretary to make some more comments.
So through you, Minister, the National Breast Screening program is actually a federal funding agreement, so there is funding both from the federal government and the state budget for breast screening. Whilst the centre will have increased capacity, most of that capacity will be on the diagnostic side, because that's the bit we're growing. Our strategy around breast screen is in fact to move to other centres, and that will see the transfer of resources to other centres, so that we're actually delivering the service closer to the population rather than just centred in one spot.
And that includes a range of new permanent sites, breast screening sites across Tasmania as well. So I think 4 new sites in addition to the...
You got the locations identified for those?
I was looking for the Kingston, Devonport, Triabunna and Glenorchy. Glenorchy, yeah.
Devonport's first, right, from a previous conversation I had with you.
And that, as we've previously said, that site's currently being established, and then that will be able to free up the mobile unit IDA to be able to travel more widely once that site's established as well.
So in terms of the breast screen budget, you mentioned it's national and state funding, federal and state funding towards that. So how does the budget for that service look this year compared to in previous years?
Yeah, would you like to comment?
Through you, Minister. I don't actually have the exact breakdown for breast screen alone. Breast screen is actually part of a division called cancer.
Yes, and that was so it's screening services, and it also includes bowel and lung screening as well. I'm not sure if it's
population screening and cancer prevention, which includes cervical, bowel and lung cancer screening efforts as well as breast screen.
So is that something you would take on notice, Minister, and provide the budget for this year and the forward estimates and how that compares to previous years?
Yes. I'm just having a look whether there's anything broken down. I've got some participation rates and things, but not
dollars.
No, but we can take that on notice,
Okay.
Ms Thomas.
And thank you. And you said the Devonport new facilities is being worked on at the moment?
Yes.
And do you have any indication of when the other 3 that were announced, Kingston, Glenorchy and Triabunna, will be commenced?
I'll ask the Secretary to give an update about where we're at with each of those sites. Start with Devonport, perhaps.
Yeah. So through you, Minister. So we've prioritised Devonport because it frees up IDA to do some sessions on the East Coast in particular, which is a concern because Luna is offline. Kingston will align with a build that we're doing to extend at Kingston. Triabunna requires us to enter into some agreements with the local government area because they run the Triabunna Community Health Centre. So I'm actually doing these in the order that they'll actually happen as well. And then Glenorchy will see a reconfiguration of our health centre at Glenorchy. So we're expecting that Glenorchy will be 2027 or 28.
Okay. Great. And the bus that is to be replaced, is there any update on that process?
Possibly no update since the previous update that I've provided, but not sure that you were aware of that. But a new bus has been ordered, been through that procurement process. A new bus has been ordered. I don't think we have any updated timelines. We're still on track to deliver that within the previously advised timeframe, which I think was by September next year.
Through you, Minister, yes, that's right. And we're hoping, fingers crossed, to be able to borrow a bus from another state in advance of that to get us going. So that because we're mindful that each clinic that we've had to postpone puts us behind in terms of the program. And the Minister's already, I think, outlined fair detail in the other place the transport processes we've put in place for the East Coast to help them get to appointments.
Yep.
So there has been some buses provided, also patient transport scheme, and Breastscreen has been proactively contacting patients to schedule those appointments. But obviously if we can get the bus sooner, we will, but if there's an opportunity as well that we've been exploring to be able to get to borrow one from another jurisdiction in the meantime, we'll also do that.
Okay, thank you.
All right, well, thanks, we'll move.
Thank you. Minister, you mentioned earlier today the 20-year preventative health strategy is being drafted. I think you said 20-year. The Healthy Tasmania strategy is coming to an end.
Yes.
And we've got $1 million allocated to the final year of that existing strategy. is there anything included in the public health services line item in the forward estimates for the implementation of the new strategy once it is developed?
Yeah, well, I think you sort of point to part of the situation there is that it is currently being developed. So that strategy currently has had some 5,000, I think, interactions from in the initial consultation from Tasmanians, which is fantastic. That's been pulled together and will shortly go out as the draft consultation. This is with a view to developing action plans for next year's, for consideration in next year's budget. Noting, I think, the point that I made earlier, which is around moving from, I think, what Healthy Tasmania has been essentially a grant-based program over 5 years to a more embedded program over time, including a sort of a whole-of-government approach. So, as I spoke about earlier, looking across portfolio areas as well. So, infrastructure, for example, looking at food security, for example, across a range of areas. So I think it's a reform, if you like, looking at a different way. So in terms of the budget, I anticipate that that costs would be spread across a range of portfolios as well. We often hear, people sort of talking, for example, about, allocating 5% of the state budget, for example, to preventative health. We've been quite careful not to lock into a number. We currently spend
3.13 of the health budget and 270 million on top of that.
In preventative health. But really, I think, you would hope to increase that level by also recognising that it sits across whole of government as well. Did you want to make some further comments, Dale?
Yeah, through you, Minister. So the reason why there isn't an allocation under Healthy Tasmania across the forward estimates is we are generally out consulting and hearing from community about what should be in the new strategy.
Yep.
And then we will cost and go to government in terms of costings. And they may not sit within public health. In fact, most of our preventative health effort doesn't sit under the public health banner. For instance, we have a large program within in Breast Screen Tasmania as a universal screening program is in fact a preventative health strategy. Oral Health run a program, etc. So it doesn't sit in this line item. Healthy Tasmania sat there because it was a grant program, and so we funded the last year of grants in the budget, but the new strategy will have ideas and implementation plans that will go across more than just public health.
Okay. Yeah, thank you for pointing that out. Is it reported anywhere, that figure you reported of 3.1% of the total health budget, not the state budget, the health budget, is what I assume you meant? Yep.
Currently.
3.1% of the total health budget is invested in preventative health initiatives. Is that figure reported anywhere?
Through you, Minister, it's reported by the Australian Institute of Health and Welfare.
Okay.
Health, yeah, that's right. So that figure is, they have a method of calculating it based on our activities, etc. But it doesn't take in anything that's spent outside of the health portfolio. So, for instance, the school lunch program in schools isn't actually counted within the
Physical activity.
AIHW.
Yep.
Any community activity isn't added and those sorts of things. So that's why we say the 5% is sort of an artificial figure, because if you worked it out, we'd actually be reducing our spend on preventative health to reach 5%, not increasing.
Yep, okay. And Minister, I'm interested to know if you're aware of the Australian Childhood Maltreatment Study and the findings that have come through from that, which I think is the first study looking at adverse childhood experiences and the impact on lifelong health outcomes for people, and whether that's something that you would consider factoring into what this next preventative health strategy looks like in terms of the importance of preventing and responding to trauma, given the impacts that it has on lifelong health outcomes.
Yeah, absolutely, and certainly I have a long-standing and quite public personal commitment to this particular issue. I think it is, you know, a very serious public health issue and does have lifelong consequences. So yes, absolutely, and I think it is also one of those examples of something that kind of sits across a range of areas, not only within health. It has health consequences, but if we're looking at prevention and early intervention, that needs to happen at various other points. Health, yes. Maternal health,
Yep.
education, I think a range of areas, and through to some of those other social determinants of health that you have previously identified, which I think are often go hand in hand as well. Yes.
Yeah,
So,
no, I totally
yeah.
acknowledge that, and pleased to hear you say that. It needs a champion though, so go be that champion.
Well, you can help me.
I
with
will.
that.
Very happy to.
Yeah.
Very happy to.